Meanwhile, and in fact, let's carry on talking about COVID-19 as South Africa and the globe continue to reel from the COVID-19 pandemic. Chinese President Xi Jinping has called on the BRICS countries to convene a BRICS symposium on traditional medicine to explore its role in the prevention of and treatment of coronavirus. For more on this proposal, we are now joined live from Durban by Dr Mahendra Pramchand, who is has been advocating for a collaboration between medical doctors and traditional healers in the fight against the coronavirus. A very good afternoon to you, Doctor. Thank you so very much for talking to us here on SABC News, sir.
Thank you.
Let's first start by talking about the link between traditional medicine and science in the fight against COVID-19. How can the two work together? It does seem that on the science side, there is a kind of unwillingness, if I can put it in that way, to collaborate with traditional healers.
I think they can work together very well. Traditional healers have been around for a very, very long time. And this is a national pandemic, an international pandemic. So I think all efforts from all angles could be used to combat COVID-19.
The Chinese President Xi Jinping has called for a symposium to be convened on the role of traditional medicine in the treatment of COVID-19. How do you kind of see this or foresee this working and taking place?
Currently, Chinese make use of various serums, powders, capsules that are of herbal origin, and they claim that it is in fact assisting with the morbidity associated with COVID-19. We have many experienced healers in South Africa who are the first point of contact for communities and a wide range of people. So I think this is a very good effort, team effort, I would say. And if everyone worked together, we would combat it. And it's very important that a symposium like this be held, because it would allow all traditional healers that from all over the world that are in contact with their communities directly and who are respected and trusted by the communities would be able to also help the community. Obviously, it must be outcome-based. And what would happen is the outcomes, the positive outcomes, must be shared so everyone would be on the same page in terms of this traditional healing.
When you talk about outcome-based, I mean, I've, for example, been seeing a lot of talk, and I can't verify whether it's true or not, but there has been a lot of talk about traditional medicine. There's one in particular, I think it's called Mhlonyane, and some people saying that this is effective, that it has helped. Have there been discussions around that, for example, particularly, and I'm really talking about with traditional sort of doctors. When I say traditional, I mean, in fact, medical doctors like yourselves. Have there been any kind of communication, kind of seeing if this is true, whether or not this has been effective in helping the scourge? Because there are some people really adamant about the fact that this particular herb has been helpful.
Our doors are open to all traditional healers. And we also have many patients before seeing us have been to traditional healers. And I would say all types of medication, traditional or modern medicine, has merits. As I say, if we could have outcome-based cases where studies could be done and appropriately formatted and made accessible to everybody, it would help, because everyone would kind of have constructive data on what's happening. So this a symposium of this nature would help establish such a platform.
I find it very interesting, Dr. Mahendra, that you are a medical doctor proposing that there should be some kind of link between traditional healers and doctors like yourselves. Why do you think that traditional healers were not brought on board really much earlier, when they had in fact been pleading to be brought into those conversations or assistance in trying to find something that might help this virus?
I really can't answer that, but the main thing is now the doors are being opened to allow them to interact with patients having the problem. So I think if we look at it, at least it's starting to happen, which is very, very important for reasons I mentioned, that everyone work together to combat the pandemic from all angles.
All right, Doctor, a great pleasure speaking to you. Thank you for being with us this afternoon on SABC News.
Pleasure.
All right, that's Dr. Mahendra Pramchand, who's advocating for a team, to join hands really with traditional medicine and medical doctors like himself in the fight against COVID-19.